As you may know, February is Heart Month, and in addition to heart health, there are lots of viruses going around. Dr. Jessica Udeogu, a family practice physician with Baptist Health Family Clinic in Rose City, joins us with some advice on staying healthy in the long term and in the short term. Doctor, great to have you here.
Thank you so much.
Yeah,
I really appreciate it.
First of all, congratulations are in order for the new clinic in Rose City. Tell us a little bit about the clinic.
It's a beautiful clinic. It's on the intersection of East Broadway and Washington. It's actually 4200 East Washington Avenue. It's beautiful. We had a ribbon cutting on September 4th, and I'm really enjoying it. Our staff and everything, we get along really well. It's great.
It's wonderful. So it's broken in good. You've been going since September.
Yeah,
for
pretty
sure.
much, yeah.
So any specific things that you specialize in there at that clinic?
Yeah, so we're a comprehensive primary care clinic, so those preventative health screenings, we do chronic disease management, of course, diabetes, high blood pressure, high cholesterol, obesity medicine. We do women's wellness exams. We do vaccinations.
Yeah.
We do all types of things that you need. Any concerns that you have, any lumps and bumps you want us to take a look at, minor procedures.
And that's what's great about having clinics in areas that are convenient to everybody, because you're more likely to get some of those annual screenings that some of us don't do annually.
Yes.
Yeah. So what are some of the screenings that we really should put on our calendar to make sure we're getting done every year?
So I understand that people go to the doctor when they don't feel well, but we need to go when we're well, because we can catch some of those things that get really good treatment once we catch them early on. So things like colon cancer screenings, cervical cancer screenings, just checking your blood pressure, making sure you're doing well. If you have a question or concern about certain things going on in your life that we can talk about, maybe we can provide you resources or point you in the right direction.
Yeah, the research shows, you know, if you're proactive about your health, my gosh.
Yes, prevention is better than cure.
No question about it. Mentioned February is Heart Month. If you could give us like one quick, do this today, it will improve your heart health. What would it be?
So, as everyone knows, diet, a quality diet, those lean proteins, vegetables are really what would set you apart from anyone else. Just do the best you can. I know that grocery bill is growing, but if you just talk to people, dietitians, we can point you in the right direction in terms of that and help you figure it out. Like get those frozen veggies. I know fresh fruit and vegetables is a little expensive, but you can do it.
It turns out that poster that used to hang on the wall at school that says you are what you eat really is.
It is.
Really, it's true.
It really is. It's just getting that quality nutrients and vitamins, a lot of things that we may take for granted, you know. So, and I get eating is a social event. We like to feel good when we eat, and perfection does not exist. You can still have your cake and cookies, but try to cut down on those sugars, see if you can drink a little bit more water, reduce your salt, pay attention to some labels, and that will really help you, especially when it goes with heart health.
I want to talk to you about viruses, because I know you see them all coming through the clinic. What are you seeing right now? I know flu's a biggie, but what else are you seeing?
Flu, RSV, COVID, the common cold, you know, and then the complications related to common cold if people have chronic illness.
Flu, of course, you can get a vaccine.
Yes, you can get the flu shot. It's not too late.
Okay, that's what I was going to ask.
Yes, it's not too late. You can get your flu shot. Flu will run into spring, and we've had a pretty intense flu season. You know, some schools had to shut down because they were getting so many people that were sick. They needed to close down and do some cleaning. So.
Yeah, I know my son goes to school up in Cabot, and he's been saying everybody's been out with the flu. So, but it's good to know it's not too late to get that flu shot. When typically, annually, does the flu shot come out? When should we get it?
So it comes out around October. However, Arkansas overwhelmingly has like a later flu season, so you can probably wait until November. But you know, some people have like employee obligations and stuff; they have to get it early, which it doesn't hurt. So.
Gotcha. If folks want to come to your clinic again, you're a new clinic, so new patients. You're accepting new patients.
Yes, we're accepting new patients. I'm there with Gia Williams. She's a nurse practitioner that works with me, so you can get on either of our schedules. You can just call our number 501 534-1300, and we're more than happy to see you. We can even get you in this week if you're interested.
Oh, wonderful. There's a couple of good pictures of the brand spanking new clinic out there. Still has that new clinic smell.
Yeah, it's beautiful.
It is beautiful over in Rose City. Oh, well, congratulations to Baptist. And thank everybody at Baptist Health for taking the health out to where people live. I appreciate it. There's the information for Baptist on your screen. Doctor, so good to talk to you.
Thank you so much for having me. Really appreciate it.
My pleasure. All right, be back on Good Morning Arkansas right after this. Got a lot more ahead.